Hello everyone, I am Dr. Sachin, Psychiatry Faculty at DAMS, and today I have the honor and pleasure of welcoming with me another INICET November ranker, Dr. Gautam Challani. He has secured a rank of 109 All India in INICET November 25 examination. Congratulations, Gautam.
Thank you so much, sir, and thank you so much, sir, for having me here on
I
this
think
platform.
you are here again. You have already appeared for a NEET PG ranker interview.
Yes, sir.
And how does it feel to give one to one back-to-back interviews?
Sir, first of all, it is like it feels good that I was able to improve on my rank from INICET May attempt, then NEET PG, and then INIT in November. It was my best rank overall. Like in May INI, I got a rank of 277, which was itself it was a good rank, but I was not able to get medicine or pediatrics. And then in NEET PG, I got an AR of 607, which was again a good rank. But I wanted to improve so that I could have a shot at the central institutes. And now that I have got a rank of 109, hopefully I'll be able to like get a central institute in this attempt. So I'm pretty happy. Thank
ये
you.
जो तुम्हारा मन था ना सेंट्रल इंस्टीट्यूट का, इसी वजह से ये रैंक आया क्योंकि 600 पे भी तुम्हें बहुत अच्छा बेस्ट ऑल इंडिया कॉलेज ऑफ योर ब्रांच आराम से मिल जाता.
Yes,
एंड आई
sir.
हैव हार्डली सीन एनीबडी ड्रॉपिंग अ सीट एट 277 ऑफ मे. 277 पे भी काफ़ी ब्रांचेस मिल जाते हैं.
Yes, sir.
277 थे ना आप?
Yes, sir. Huh.
क्योंकि ऐसा नहीं है, 277 और 109 में हार्डली 2 या 3 एमसीक्यूज मैक्सिमम डिफरेंस होंगे. आई थिंक
Definitely.
सो. ऐसा.
Definitely.
बट सबसे पहले मैं पूछना चाहूंगा, व्हाट वाज योर मोटिवेशन टू स्टडी आफ्टर नीट रिजल्ट, बिकॉज एज यू नो मेनी ऑफ योर बैचमेट्स फ्रेंड्स वर नॉट स्टडिंग आफ्टर नीट. वर यू स्टडिंग फॉर दिस INI?
Sir, actually speaking, when the like I didn't know when the NEET PG will happen. Like initially when May INICET happened, and then I was prepared. Like then I was giving NEET PG on 15th of June. Then it got postponed. So then I knew okay, like it will happen on 3rd August. So I was prepared. Like I might have to give INI November. Like we didn't know about counseling when it will happen, what will happen. So like I was like in the back of my mind, I knew that I might be appearing for INI again. So like after the NEET exam, like I like relaxed for a week or 10 days. Then I just picked up the pace slightly, like just gave a test or like, so that just revised, just gave some MCQs or like just did some Q banks to, like get up with the pace, and then started studying regularly by I think end of August or September beginning. And then like intensively, like initially 1 to 2 hours daily, because I knew like I would not be able to sustain for longer duration if I just started up, because eventually it will be not productive for me. Then I picked up the pace in mid-September, and then by October, like I was studying for like 5 to 6 hours every day. So I'm giving GTs regularly, like sometimes once a GT every week, or 2 GTs in 1 week, and revising them properly, revising the PYQs again, because as everybody knows that in INI, the PYQs are very, very important, because sometimes they get verbatim repeated or the topics get repeated in the form of the multi-correct questions they have in the form of four options, and then choosing which of them are correct in the combination type statement. So like I think that is how I was able to get this rank.
So you were studying, but not to that extent as much as you were studying for before NEET. But
Yes,
you
sir.
were
Yes, sir.
studying.
Yes, sir. Like because it was not like, because there was no certainty, because I did not know when the exam will happen, if we'll be eligible or not, because we did not know about counseling, when it will begin, when we'll have to report. So I was like unsure about it, but still I felt like I should start studying at least, that so that I don't regret it later on. And so thankfully I was eligible to give the exam and like got a good rank.
May you gave the exam and you got 277. August you gave NEET 600 something, and then November. First of
Yes.
all, tell us the difference between NEET PG and INICET paper according to you.
Sir, I felt that in INICET exam, the focus is more on the pre and paraclinical subjects. Like the questions there are relatively more and relatively tougher. Like I remember in this May INI, November INI, the questions levels was slightly higher for the pre and paraclinical subjects. So even though I had studied, yes, but still I found a little bit more difficulty in solving those questions in the specified time frame. And moreover, the in NEET exam, the distribution is very different. The focus is more on the clinical subjects, and there is more weightage to that. Secondly, I feel the time aspect is very different for INI and NEET exam, because in INI you have to do 50 questions in 45 minutes. That is, I had calculated that it is every question requires 54 seconds to be solved, and in like a NEET exam, you have to do 40 questions in 42 minutes. That is like more than 1 minute per question. And generally speaking, the in NEET PG, the questions are more straightforward. So that like some questions are very easy, like you can do it in 15 to 20 seconds. So that is why you get more time to revise that particular section and correct your mistakes. But in INI, that is not the case. You have to be very quick to complete all the sections. You have to pick up the pace from the start, and like complete the section fast. And secondly, the review mark for review part in INI, that you cannot leave the questions for review, because it will not be considered for evaluation. But in NEET, it is considered for evaluation. So you have to be completely sure while marking which question is um, you want to attempt. And also the negative positive ratio is different. Like in NEET PG, it is +4 and -1, but in INI it's like +1 and -1/3. So each negative will cost you more. Like I at when as the ranks get, like as we go down the ranks, I had seen that even at this one specific correct options, like many rankers will have like a specific number of correct answers, but the incorrect number of incorrect options will determine your rank, and it will severely affect your rank. So that is the difference I found in NEET and INICET.
Yes. So this is on the day of exam, which
Hmm.
matters to a student who is appearing the exam.
Yes.
Let's take it from the beginning. When you were a third year student, MBBS student, you joined DAMS, you mentioned me.
Hmm.
At that time, do you think for an undergraduate it is different how to prepare for NEET and how to prepare for INI? At MBBS level कोई difference है या same है?
Sir, I feel that you have to master your first and second year very well, that you should read your standard textbooks from the start. You should not rely on any like supplementary textbooks. You should first, like in first and second year, you should completely focus on the standard textbooks. Like for physiology, we have Genong and Guyton, and for pathology, we have Robbins. And moreover, I've seen that some images are straight lifted from your Genong and Robbins, and the facts. The captions also are very important. I don't remember the exact question, but I did that incorrectly. But I found that answer in the one of the captions of the for the in the Robbins textbook in an image. So that highlights the importance of the pre and paraclinical subjects and reading the standard textbook in the first and second year, because we have more time, because we in first and second year we have only 3 subjects, and like each, and we have more time to us. And so that we should be focusing on, we like in first year we don't have any clinical postings, and in second year most of the students are not very willing also to go, like honestly.
Hmm.
So we should focus on our pre and paraclinical subjects too, which will also help to build a base for the third and final year subjects, and also for INICT, because they are asked in great depth, and there is like endless amount of things you can ask in those subjects in the first and second year. Well,
Hmm.
that is what I would suggest to any person who is starting to prepare in third year, like to master your first and second year. If you have not read in detail in first and second year, you should use your third year time to finish up your Robbins and Genong and any other textbook which you have referred, so that you build a base for the clinical subjects, and master them for INICT exam.
When in third year, suppose you have done the first year, second year properly, tell us your journey with DAMS. When did you start preparing along with DAMS?
I started in third year, yes, but I was not very focused in the third year exam. I focused on other things, but yes, I used to study some topics in ahead, and but especially in medicine, because I felt that medicine is very vast subject and I would not be able to complete whole of medicine in final year. So I did some few topics of medicine in the third year itself, so that I am like at a comfortable position in final year. And some topics of surgery and a major chunk of ops I also tried to do in third year, because in generally ops is more focused in the clinical postings also. So I used to like basically whatever case we took in the wards, and I used to like come home and read up about it and watch the lecture and make notes about that, and solve some Q banks, so that the concepts get solidified and I am able to identify my mistakes. And surgery, because in MAMC the surgery postings were very intense and we used to see a lot of cases, so that I tried to read up that cases like hernia, breast, and any lump and swelling. So I used to read it from the clinical textbook of S. Das and used to simultaneously try to cover those topics from my notes. And so that I felt that it was necessary, so that I have a less burden in final year, because final year will be even more intense with uh, completing those subjects, and then completing also the minor subjects, and then revising the first and second year will be a major challenge. So that is why I took an early start for some subjects in third year.
Yes. And how did you manage to revise these things in your internship?
So basically, I started with my medicine internship. So frankly, I could not read any at that time, because it was a very life-changing experience, I would say, and like it was hectic. And ma'am, see, the medicine internship is very hectic. So like I would advise to like just basically when you are there, so just try to see what cases are there and focus on passive learning, like because learning in any form would be beneficial for you in an exam. It may not be possible sometimes to like read up on every day, but like you can solve MCQs if you are like while traveling home, or like while you're going to hostel, or while you're waiting for a report to be come on, and you can passively see the cases which are present in the wards, and so that it will help you later on. And secondly, then I had some relatively easier postings. So what I used to do is I first of all focused on my weaker subjects like anatomy, microbiology, and then subsequently moved on to the subjects which I have a strong hold on. I used to basically revise the notes, then solve the previous year questions and review my GTs. And I used to try and give GTs every once a month initially, and then as we were moving closer to the INICET, then basically once I was giving once every 4 weeks, then once every 3 weeks, then 2 weeks, then once every week. And I would simultaneously be doing the PYQs, and I was like revising the PYQs also. And before INICET in May, I had revised it twice, the PYQs, and then revised them again between the INICET and NEET PG, and then one more round of revision of PYQs from between the NEET PG and INICET November exam.
In your 3 years of journey with DAMS, which was the resource, which was the thing in the DAMS app or in the classroom that was most beneficial to you?
I think the test and discussion for me was very, very beneficial, because one thing is to like know the content of your thing, of any subject. The other thing feel is that the one important thing is to know what are your mistakes, because like you can read content on and on, but but you have to know what are your weak points. You have to practice the questions and then discuss it, so that you can gauge any another modification of the question which may be asked in the exam. So I felt that the test and discussions were very useful, which helped me to catch my weak points and act on that. And also it helped me revise the subject in its क्या कहते हैं, the because in TND you will get the most important questions which are based on PYQs, on what the teacher's experience tell you, which may be expected in the exam. So I felt that it was very useful for me. And also the
Really?
DAMS predictor series I saw before the exam, which was also क्या कहते हैं, useful for me. So I would highly recommend that before the exam.
Okay. Any other source apart, any other thing in dams that you used apart from TND? Any test, CBT, DVT?
Yes, I also gave the online tests from like the grant tests. So basically, I feel that grant tests are essential for your the preparation, because the grant test will give you three kinds of questions. And first of all, it will help you to gauge, like, if you are able to solve the questions in time. It will help you catch the speed. It will help you revise, see the weak points of the subjects, and most importantly, you have to revise it in a particular form so that it is most beneficial. You're able to utilize your time, because internship is very hectic, so you cannot spend too much time, because you have to be on your duties and also read up and revise the GTs, revise your mistakes. So what I used to do is I used to divide the uh, basically there are three kinds of questions. Like, one is the when you got correct answers, then there are some which you got incorrect, and some of them are missed, or some of them were you have guessed. I used to consider the guessed ones and the which I left as incorrect only, because I felt that I have guessed it in this GT, but I may not be able to uh, do the same thing in exam. So I used to treat them as incorrect only and used to focus more on those incorrect questions. If the time permitted, I used to look at the correct ones also. But if there was a time crunch, or if I was not feeling well, I have to report for duty, then I would focus more on the incorrect ones first, and then move on to other questions.
Very good. You have mentioned a very great way of reviewing GTs and correcting the mistakes.
Mm.
Okay. Any general advice from your side before we finally close this interview without any question? Anything that you want to tell to your juniors who are listening to you right now in this video?
I would say that just do something every day. Don't feel like I have not studied much this day. Don't take the pressure to the next day. Just focus on doing something, like be productive every day, because like I feel that it is not possible to read 6 to 7 hours every day. Like, it is not possible. Sometimes you're not feeling well. Sometimes you cannot study. So take that day off. Just solve some MCQs also. Like, just do something each day, so that at the end of the journey, you'll feel that you have done enough. Because it is not, you're not at your best every day. Sometimes you have a bad day. Sometimes you're not feeling well. And sometimes you can read even 10 hours. Sometimes you can only read 2 hours. So don't feel that like, don't take the pressure on the next day. Just do something productive. That is my advice. So, and be consistent. Don't feel like, start early and be consistent with your preparation. Be sincere. You'll definitely get a great rank in any exam
Great.
you will appear, whether it's INICET or NEET PG.
Great piece of advice, Dr. Gautam. Thank you so much for being with us. We wish you all the best for your counseling and hope you get your branch of choice in your college of choice. Thank you so
Thank
much.
you so much, sir. Thank you, sir,
Thank
for
you.
having me.